Okay, thank you very much, Christian. My name is Nilawan Pitakpanawong. Right now, I'm working. Oh, okay, all right. Right now, I'm working in the Development for Quality of Life Lahu Association as a director, and we have many things to do in organization because right now we are start to do the activities after we stop the activity because COVID-19. Yes, so I would like to tell you about mobile methadone therapy for drug users within ethnic groups in Phang district, Chiang Mai, Thailand. Today I will share you about this. Yes.
Yeah, so I think before we talk about the mobile methadone therapy, I think could you give us some background on the drug use and the communities that you work with?
Yes, and the northern region of Thailand, bordering with Myanmar, is known for the several ethnics here, like Lahu people, Karen people, Akha people, Thai people, and many ethnics here. And in the past, ethnic groups have been using opium for treating illnesses such as stomach aches and diarrhea and like release the pain from work like that. Yes, and the village located on the mountain, so the distance between the village and hospital very far, and the road is not good. The journey is very difficult, and another reason is they don't have vehicle to go to hospital in the past. So this is why they use opium and in the daily life. Yes.
Do you know how prevalent the use of opium and opioids is at the moment?
Again, please.
Like how is it like a very big problem at the moment among
Yes.
community?
Yeah, because some of them after the use daily use, they addict and they cannot stop. So this is the problem in the community. And another is amphetamine. Right now amphetamine very cheap in the community, just only 10 or 20 bahts like that. Yes, and so teenagers become to use drugs right now. Yeah.
Do you know, like, do you have any information on where it's from? Like, is it coming from Myanmar? Is it coming from other different sources?
Oh, okay. The village of our ethnic groups near border, and some is located border, so they easy to pass yes.
Yeah, so some of
Bring
the
drugs from Myanmar and from the Thailand, and they to share together like that. Yes.
I see. So some people started using because they couldn't go to hospital, they couldn't get healthcare.
Yes.
They were using it as a way to like self-medicate.
Yes.
And then others just because it's so easily available now. What happens if, say, they are caught by the police?
Oh, again, please.
What happens if they are like caught by the police?
Yeah, because if they are going to the hospital, the police catch them because they use drugs, and they have the drugs in their bodies. So just they saw the police, they very afraid, so they cannot go to the village. And some of the police come to the village to catch them. Yeah, right. So this is why they don't want to go to the hospital to get the service at the hospital. Yes.
given this sort of background, how did you start the mobile methadone program?
Okay. For Thailand, for Thailand, they have like a methadone program for more than 30 years. The concept of a substitution long-term methadone is academically and internationally recognized as having a positive than the antidepressant service. Thailand at the policy level in the particularly the Ministry of Public Health has accepted this matter, but in practice, the provisions of service is still limited, can be seen from in Thailand. There are hospitals across the country than 100, but there are only 100 facilities providing. Oh no, the country than hospital across the country than 1,000, but there are only 100 facility providing methadone replacement service. More than 10% of our hospital are comparable to number of statistics of drug users receiving service across the country. It was found that the number of people who receive only 10% of methadone replacement service compared to the figure. It is estimated that drug users in this group need methadone replacement therapy. So for my project, this project start very long time, but in Phang district, we start because we have like a fund from global fund, and I work since 2020 first, yes. And when we can do this project, because why we can do this project, because we have like a plan the project in the level of national strategic planning meeting between civil society and government. And the second is related agency, both the Department of Disease Control, Ministry of Public Health, Police Department, Military Department, and local administrative organizations. And the community leaders, people in the community. This is the main point that we can do like a mobile therapy. And after we have a meeting planning, national strategy planning, we must plan our operation in line with the national strategy plan, because civil society has not cost, but the government has cost, including budget, technicians, and tools. But our civil society, we have staff, we have the knowledge, and we have ex-or drug users who can be a volunteer to work in the community. And we have staff who are the community members. Yes, so we can do this project. And after we have the plan, we have meeting in the local areas too, for we have meeting with hospital and local authorities and local administrative organization and community leaders, and the people in the communities should understand too. So we have like a talking, and we have like a meeting and seminar with the community, and we plan to have this activity together, and we explain them about how we will do this project, and if we do this project, who will receive like benefits from this project, and then we can do this project. Yeah.
Was it hard to convince the government that they should do this project?
First time, yes, first time very hard because they don't understand about our drug user situation. They just have like in the in how I can say in the paper, yeah, but in the practical, our drug users, we have many problems, and we have like difficult to reach to them. Yeah, because if governmental organization, I think they can do if they force them, but if we force them, they are just coming in when they forced, but after that they miss. Yeah, so I think civil society organization can help this gap very much. Yes.
Yeah. So how do you, when it's very difficult to convince the government, what do you have to do or say to convince them?
Because they think drug users should stop to use drug. This is their mindset, so we should explain to them in the meeting. We invite the leader of a governmental organization come to have a meeting with civil society organization and explain to them why we have to do like this project like that, and explain them about the situation of our drug users, and explain about how and what, when, why we do like this. So if their leader, governmental organization leader, know about the status, and they will accept our opinion and help us like that. Yeah, just I think we should talk face to face, because if you don't you don't have time to talk with the leader and talk with the practical levels, they cannot understand. So we have like a two level, we lobby in the leaders of governmental organization, and the staff, we should do this project together like that. Yeah, cooperate. Yes.
So are these like the local, is this like the local government leaders, or do you also like have to go to Bangkok and speak to the higher level?
Yeah, because this is the project of a global fund, supported by global fund. We have the policy team in the core of the Bangkok, and they work together with the governmental organization in the core, and we are the part of a local level. So we do like this two level together. Yes. Yeah. We cannot do like in the local part if you do not advocate in the policy at the core center. Yes.
Yeah. So how does this program work? Like, do they come to you, or do you drive around and have to go to them?
Again, please.
To like describe how the mobile methadone clinic works. Like, how many people need to run it, and do you drive to them, or do you go to one place and they have to come to you?
Yeah. Okay. All right. I have I had work in the 6th district of Chiang Mai, in the north of Chiang Mai, Mae Ai district, Phang district, and Chai Prakan district, Vieng Hang district, Prao district. Yes. And Chiang Dao district. 6 districts in the Chiang Mai, and the drug users will come to receive the treatment in the 2022 is 118 clients. This is they come to usually come and not miss, So why it work? Because first of all, we have the staff and volunteer which is ex or drug users in the community, and they reach to the drug users by themselves in the community. So the drug users trust in their friends, because their friends told about the benefits that if you come to join our projects like this. And after that, they give appointment to go to the hospital first, because they should start methadone therapy at the hospital first, that 6 district. And after they check up and follow up for 2 or 3 times, they can receive methadone therapy in the community like this. So the staff of the hospital very friendly, and they have friendly service for methadone for clients. So our drug users need to come to receive, because the staff or the nurse or the doctor, they speak friendly, and they talk friendly, and they explain about the service like a friendly. This is the point that they come to receive. And another one is our staff go to the hospital with them too, not let them go just alone like that. Yeah, our staff go with them and service with them, and help and explain everything, because we have the barriers of language too, because ethnic groups they cannot speak in Thai language. So our staff explained about the Thai language and interpreter for them. Yeah, this is why they are coming to receive. And after they come to get service, they can working in the day, because at the past they use heroin and they use opium, they cannot work all day, they just or like this. But after they get treatment, methadone therapy, they can earn money they can work, and they had more money to spend to other things, and in their family, and their health improve. This is the good things for them, and they had better family lives, because before they come to have treatment, they have like a conflict in the family, and some family they just divorce like that. Yes. So I think if we have just one people in the community come to get treatment and have better life, another drug users in the community become motivated to receive treatment. Yes. This is that I think we have success in the some levels. Yes.
Yeah. So I just had one question left, but just for people who are in the audience, if you have any questions, you can put it in the Q&A
Yes.
section, and then we'll look at those as well. But I think my last question was just kind of to do with the overall environment, right? So because drugs are still mainly criminalized.
Yes.
And also, I think whenever drugs are criminalized, it means a lot of members of the public are also very anti-drugs and discriminate against drug users. So how does this environment affect your work?
Okay, all right. Uh, in the past, drug users were viewed as criminals, but now, through hard work and a combination of many sectors, like governmental organization and civil society organization, it can change the mindset of both working people and in the law too, that drug users are become patients that should receive treatment like that. But in practice, it still does not cover all areas and all of organizations and some communities. So drug users are still viewed as bad people in some community, that they don't have like a project like this. And society and people in the community are still afraid and unacceptable, still discussed. Therefore, it is the thought that we must continue to work together in the future for people in the community and society, including the government agency themselves, understand that drug users are people, human beings like everyone, deserves to be treated and have rights like a normal people. It is the work of all sectors, I think, because in right now in the Thai society, they know about the new laws in drug, but in the practical, it cannot cover all of the community and all of organization like this. Yeah, this is, I think, the gaps that we need to do more for harm reductions.
Yeah, I think, yeah, in Singapore also, it's very similar. When people think of drug users as criminals, it makes it harder for drug users to seek help.
Yes.
Because they feel like people are judging them. So we have 2 questions in the Q&A. So one question is, who is paying for this methadone treatment at the moment? And also the other question is, can methadone actually be used for methamphetamine?
Again, please.
So the 2 questions, the first one is, who is paying for this methadone treatment?
Who
is paying? So like,
okay, all right, okay.
And the second one is, can methadone treatments be used for methamphetamines?
Okay, all right. In our project, in the past, methadone is like by law, methadone is a drug, must be in a licensed medical facility only, but it is an advantage in our project, and the doctor can bring the drug and the doctrine of provincial provincial health ministry. Yeah, they help us let the doctor and to bring the methadone therapy for drug users in the community. Yes, this is the nurse and not nurse, how can I say, a licensed medical, yeah, the nurse who has a license. Yeah. Yeah.
So the program is funded by the Global Fund and the government. So
yes, Global Fund. Yeah.
okay.
Yeah.
Yeah. And so do they use the methadone only for people who are using?
Sorry, my voice.
It's okay. So do they use methadone just for people who do they use methadone just for people who were using opium or also for people who are using methamphetamine?
Oh, okay. In our Thailand, the methadone therapy, we can give just only 450 ml for one person can bring to this is by law, allow just only 450 ml. So this is not enough for drug users, not enough like a dose for 1 day. So our drug users who treat like a methadone therapy, they are also use another drugs too, like a opium and a heroin and some amphetamine too, because they said they cannot say in the day. Yeah, because the dose is not enough for them like that. This is the problem. Yes, so they use another drugs when they have treatment too. Yes.
How often can they get this treatment from you?
In 1 month we bring to the village just only one time, because we have limited staff and about the time. Yes, so just only one time in the community. But if another one who has like a high dose, they should receive treatment at the hospital.
Yeah.
Yes.
So it's still very difficult if your program is not allowed by law to give them enough for the full treatment. So they're only getting partial treatment at the moment.
Yes. Yeah.
Is it hard to convince the government to like let you expand and give them the full treatment?
Yeah, right now I think the program will talk about sustainable in the community. How can the community can provide this mobile methadone with like a local hospital, and how the local authorities and local administrative organization will help the budgeting, the funding, and the staff to help this project. Yes, this is the plan that we will talk about the sustainable in the community to do this mobile therapy. Yes.
Justin, you're muted.
Sorry. Okay, now. Yeah,
I cannot hear your voice.
Can you hear me now?
Yeah, okay.
Is it very difficult to do this lobbying?
Yes.
Then they need to do you have this issue in Thailand where when people hear about harm reduction, they feel like you are just helping or encouraging people to take drugs?
Yes, I think this is the same in the every country, because this is the part of governmental organization and local community people. They think like this. They think like this, but we should explain to them and to do the project and to show about the benefits and the outcome that we receive from this project to them, so they can understand and accept. But we should need more time. Yes. Yeah.
How do you get them to accept? Because I think that's one of the challenges we have in Singapore, that it's very difficult to get the government and the public to accept.
Yeah, I think the first thing that we should do is we have a meeting face to face with who has strategy planning. Yeah, who has the position there, and we should talk about them and lobby them and explain to them like this. I think this is the first time, the first thing, and after that we must do in the community, reduce stigma in the community too, because they don't understand about the drug users situation, so they just know about that they are criminal and like this and the bad people like this. So we should reduce stigma in the community when we talk with the governmental organization leaders. Yeah, this is two things we should do together.
Yeah.
And I think right now media can help us very much. Yeah.
Mm.
Yeah.
Yeah, so I think we are coming up to time because we were going to run until around 8, right? So we're coming up to about time. So if anyone has any other questions, this is like your last chance to put it in the Q&A. And yeah, so I think, you know, it's really helpful to learn from Thailand's experience because, you know, it's a lot of the times we kind of feel like, oh, maybe drugs need to be decriminalized before you can do harm reduction. But I think it's really helpful to hear from communities and from societies where even if it's still criminalized, people are trying to do the work
Yeah.
and to see what we can push for. I think it's been very difficult. There have been some efforts in Singapore to, you know, and the government has moved to kind of get the government to like first agree to community support and rehabilitation. So it's not always mandatory drug detention. It's not always prison.
Yeah.
We can move further into that because we really don't have any of these harm reduction programs. I don't think we don't have any methadone therapy programs that people can have access to. So like, thank you so much for sharing your experience from
Yeah.
Thailand. And I
Yeah.
hope that, you know, you would have success lobbying and working in the communities.
Yeah, thank you. And I would like to say to everyone that I would like to tell you more about my works and my experience, but I have the barriers of my language because of my English is not strong. So just I can explain you just like this. And I think if somebody has more questions and you need more like information, you can ask me by my email and ask for Chrissy Hans. Yeah, contact me. Yes,
Okay.
like that. Yes. Yeah, thank you that you have invite me to tell about my experience to every people and everyone who work in drugs. So I think drug users is our brother and sister. So we need to help them, and we need to work more and more to explain social and society and the community to understand them too. Yes.
Yes.
Thank you.
Yeah, so before we close this session, I think I just wanted to let people know or remind people, if you are planning, that in July, TJC is running our abolitionist festival. So we have more events related to drugs and drug policy, but also death penalty, prison conditions, and transformative justice. So if you want to find the full program and also how you can register for it, you can find us at tinyurl.com/TJFest 2023. And so you can join us for those activities there
Yes.
too. Okay. Thank you, everyone. So
Thank you.
Thanks.
Okay, bye.
Bye.